Well, good afternoon and welcome to today's seminar. The seminar is being brought to you by your E-Extension Dairy XNet group. My name is Dr. Bob Van Saun. I'm one of the extension veterinarians at Penn State University and a member of the program committee for Dairy XNet. And we're very pleased to have a new direction in some of our webinar topics to talk about some very important diseases of dairy cattle, and today's topic will be on bovine leukemia virus, brought to us by Dr. Ray Sweeney of the University of Pennsylvania. Dr. Sweeney earned his veterinary degree from the University of Pennsylvania School of Veterinary Medicine. After he graduated, he completed an internship and residency in large animal medicine at Penn Vet's New Bolton Center. This is where he has been a faculty since his residency program. He currently is the Chief of Medicine at New Bolton Center. Dr. Sweeney is a clinician in the large animal hospital at New Bolton Center, handling medical problems of cattle, horses, and other farm animals. And his research interests include another important disease, Johne's disease, and other infectious diseases of cattle. It's with great pleasure that I give you Dr. Ray Sweeney. And Ray, go ahead and start your seminar.
Well, thank you very much. It's a pleasure to be here this afternoon, and thank you all for joining in. This is just a brief outline of what we'll be covering this afternoon. What is BLV? How do cows get BLV? How do we know which cows have it, and how many cows have it? What happens when cows are infected with the virus? What diseases does it cause, and does it have any other effects on production? And then finally, we'll end with what can I do to control BLV? So we'll start right in with what is BLV. And BLV is a retrovirus. It's a family of viruses. The BLV stands for bovine leukosis virus, although it is also often referred to as the bovine leukemia virus. And it's an oncogenic virus, meaning it's a cancer-causing virus. And the cancer that it causes is referred to as enzootic bovine lymphosarcoma, or often we refer to that as lympho for short, or lymphoma. So continuing on with what is BLV, I mentioned it's a retrovirus, which means it's in a family of viruses that cause cancer in a variety of species. There's the avian leukosis virus, which can cause cancer in chickens and other birds. There's the feline leukemia virus, which if you're a cat owner, you may have even vaccinated for that virus. There's also a human closely related virus called the human T-cell lymphotropic virus, which causes leukemia in people. It's also a more distant cousin to a virus that you're familiar with from the press, which is the HIV virus. And if you have goats or sheep, caprine arthritis encephalitis or ovine progressive pneumonia virus. So it's in a family of viruses, particularly closely related to viruses that can cause cancer in other species. Now, these viruses are generally thought to be species-specific, meaning they only infect the host, their specific host. So, for instance, the feline leukemia virus doesn't infect cattle or dogs. It only affects cats. And for many, many years, the conventional wisdom has been that BLV, the bovine leukemia virus or leukosis virus, does not infect people. And this has been what I have been teaching my veterinary students, and when I've given talks, this has been what we've always said. And the world has turned a little bit for us in the last month, believe it or not. And there's now some new research which calls into question this conventional wisdom. And there is now evidence that the bovine leukemia virus can indeed infect people. And this is an image of the title page of the study that I'm talking about. This is a study that was performed in Berkeley, California by physicians there in their hospital. And as you can see, the title of the article is Exposure to Bovine Leukemia Virus is Associated with Breast Cancer. This is, of course, in people, a case control study. So in this study, these researchers took biopsy tissue from women that had biopsies or mastectomies, and they tested the tissues to see if they could find bovine leukemia virus in the tissue from that had been removed because of cancer. And then they also took tissue samples from women who did not have cancer that had tissue removed for other reasons, and they looked for BLV in those tissues as well. And what they found was somewhat earth-shattering, and that is that in the women that had breast cancer, they more frequently found the BLV virus than they did in the non-cancerous controls. And the more virus they found, the more likely the woman was to have cancer. So this is really an earth-shattering phenomenon, which if additional studies prove it to be true, may change the way that we think about BLV, which up until now has really been just considered a livestock issue and not a human health issue. Well, let's get back. We'll talk some more about that a little bit later, but let's get back to talking about the retrovirus, the BLV virus in cows. There's a few important facts about the way this virus behaves that will help us understand some of the disease processes that we see associated with BLV in cattle. The first is that once an animal is infected with the virus, they remain infected for the rest of their life. And the virus is always present in their white blood cells. So this means that an infected animal is infected for life and is potentially infectious, meaning she can give the infection to another animal because that virus is always in her bloodstream, harbored within her white blood cells. The second important fact about BLV, and this is, again, similar to many of these other related viruses, is that there's a very long incubation period before the onset of cancer. So in cows infected with BLV, it may take 2 to 4 years or even longer before an infected cow would show signs of the lymphosarcoma, the cancer that the virus is associated with. And more importantly, in the case of BLV, and I can't emphasize this enough, and you'll hear me say this over and over again this afternoon, many, and I would say most, infected cows never become diseased. With the BLV virus, only about 2 to 3% of infected cows ever get sick with cancer. So even though half the cows in this picture may be infected with the virus, at most maybe only 1 or 2 will ever get cancer in their lifetime. That's an important fact to remember. So that's a little bit of background about the virus. Now let's talk about how do cows become infected with the bovine leukosis virus. Well, this is a virus that is transmitted by blood. Remember I said that the virus lives in the white blood cells of infected cows? So any sort of process that would involve exchange of blood from an infected cow to an uninfected cow will transmit the virus. And there is enough virus in 1 drop of blood to infect another cow. So it's a blood exchange transmission. Well, how does that happen in cows? There are not too many that are IV drug users sharing needles, but there are a number of ways that blood, and specifically white blood cells, can be exchanged between cows. And the first, and really what was thought to be the most important method for many years, is biting flies, flies that take a blood meal. So if this fly were to bite a cow and suck some blood from a cow that's infected, and then she were to fly over and land on a cow that's not infected and bite her, she could inject some white blood cells from the first cow and infect the second cow. And so this is a very important means of transmission, and one of the reasons that we see even more widespread infection in the south, where flies are more of a problem than we do in the north, although it's widespread pretty much everywhere. Now, while flies do play a major role in transmission, unfortunately, humans, veterinarians, and animal handlers have also contributed to the spread of this disease on our dairy farms by doing procedures which promote the exchange or exposure of uninfected cows to blood from infected cows. And if you think about some of the common invasive procedures that occur on dairy farms, dehorning is one of the most common, and of course can be, depending on the age and the method used, can be a very bloody procedure because the horn buds have a pretty strong blood supply. And so gouge dehorners or Barnes dehorners, those that involve actually cutting off the horn and have bleeding associated with them, if these instruments become bloody and are not thoroughly disinfected before they're used again on a second animal, then the virus can be transmitted. And this has been shown in several studies to be a significant risk factor for increasing the incidence of BLV on farms. The second would be other surgical instruments like castration instruments, potentially tattooing instruments, have those little needles that poke into the ear, and they could be contaminated with a drop of blood. Remember, I said it's only just one drop of blood. And also using common needles, repeat dose syringes. If this is, for instance, is being used to inject a vaccine, and you go into the muscle, you get a little drop of blood in the end of the needle, you go into the next cow, you could exchange that drop of blood. So all of these procedures that involve sharing of blood or exposure of blood from one cow to another, or that humans have promoted, are ways that BLV has been spread on farms. Another way that BLV can be shared from an infected cow to an uninfected cow is by rectal examination, which of course most commonly is done for pregnancy diagnosis. And it's a very common procedure, as you know, to have several cows lined up to be examined, and the veterinarian will go down the line, and we usually don't necessarily change our sleeve between every cow. But research that's been done at Penn and has been corroborated at other sites has shown that if the first cow has BLV infection and you do a routine rectal examination, even if you don't have visible blood on your sleeve, if you then go and use that same sleeve to palpate an uninfected cow, you will transmit the virus to her. So this is another way that the virus is spread, by using the same rectal sleeve on going from an infected cow to an uninfected cow. And again, I emphasize, you don't have to have visible blood on the sleeve for that transmission to take place. And then there are some other, probably less common ways that uninfected animals can be exposed to white blood cells from infected animals. We know that cows that have the BLV infection, they do excrete the virus in their colostrum and in their milk. So calves that drink that colostrum or milk could potentially become infected. It's not as common as the other means, but it is potential. And of course, the fact that the virus is in milk is also a concern now for the human aspect that I mentioned earlier. We also know that if a cow is infected with the virus, her calf can become infected even before it's born. Again, this is fairly rare. Usually these calves are not born infected, but it does happen in a small percentage of the cases. And then just direct contact, nasal secretions, urine, other bodily secretions may have white blood cells in them, and then so an uninfected cow or calf could become exposed that way to white blood cells. And semen is also another potential source. Bulls that are infected will have virus in their semen occasionally. This is not such an issue with artificial insemination, because we know that the bulls are tested at the stud before they're put into service. But for natural service, this is another potential way that the virus could be spread. Okay, so now we're down to how do we diagnose which animals have BLV and how many of them have it and who has it. So remember that I mentioned once animals are infected, they'll be infected for life. And within about 4 weeks of becoming infected, the cow will develop antibodies in her serum, which can be very easily detected. And those antibodies are not only in her serum or her blood, but they're also in her milk. So there are a number of very simple, reasonably inexpensive tests that can be used to identify infected cows. And these include serum tests to look for antibodies, which would either, and ELISA now is the most common, but you may also hear about an AGID. These are just two different methods of looking for antibodies. Now also we know that we can find the antibodies in the milk and that the milk test and the serum test have pretty similar accuracy. And the milk ELISA test is now available through some of the DHIA organizations, and so that's a fairly convenient sample to test. Bulk tank milk can be tested as a sort of a whole herd test, and it's been shown that if you have one cow infected out of 100, those antibodies should show up on the bulk test. So that's a way you can screen a herd. Won't tell you which cows are infected or how many, but at least can tell you if you have the infection. Now, like every good rule, there's an exception, and the exception of the rule for BLV testing is in young calves. We know that because if the cow is infected, she'll have antibodies in her serum. She'll also have antibodies in her colostrum. She will give those to her calf, whether or not the calf is infected. And those antibodies can last for about 6 months. So you really can't use the blood test to diagnose infection in a calf until about 6 months of age. If a calf that's less than 6 months is positive on the ELISA or the serum AGID, it could be antibodies from her mother if her mother was infected. And that wouldn't necessarily mean that the calf is infected with the virus. Well, how widespread is this infection in the United States? We know that in Europe the incidence is fairly low, but unfortunately in the United States, and some of it due to many of the factors I mentioned as far as how easily it's spread, these are the results of a survey that was performed about 7 or 8 years ago by the USDA National Animal Health Monitoring Service. And it breaks down the percentage of herds that have at least one infected animal, and it's for various geographical regions in the United States. You can see that here in the south, on this bar, in the southeast, 99%, virtually all of the herds they tested had at least one animal infected with BLV. In the rest of the country, the national average is close to 89 or 90%, and you average these all together. So 89 to 90% of all U.S. dairies have the infection. And when you look at individual animals, again, the national average is about 50%. So about half of all cows in the U.S., half of all dairy cows in the U.S. are infected with this virus. So virtually all herds, 90% of all herds, and 50% of all cows have this virus. And for beef, because they're raised a little bit differently, maybe less intensively, grouped together, spread out a little bit, the percentage is a little bit lower. About 50% of beef herds on average are infected. So now let's talk about what happens to a cow once she's infected with BLV, with the virus. What disease does it cause, and what is the effect on her production? So just as a reminder, I mentioned that when a cow is infected, within 4 to 6 weeks, she'll develop antibodies in her blood, which will be then a signal for people that are doing the diagnostic test that she's infected, and she'll stay that way for the rest of her life. But now I get back to the point that for most cows, that's the only change that will happen. It will not affect their production. It will not affect their longevity. The majority of cows with BLV infection never get sick. It's only about 2 to 3% of the cows that are infected will ever develop cancer. And remember, the cancer is lymphoma or lymphosarcoma. And again, you have that long incubation period, 2 to 4 years usually at least. A couple of other facts: there is no practical treatment either to get rid of the virus, nor is there really a treatment for the cancer if a cow is one of the unfortunate 2% to develop cancer. And I should mention, it's not on the slide, but there is no vaccination currently available for BLV. So let's talk about the impact then in, say, a commercial dairy herd that's not trying to sell replacements overseas. The economic impact will be associated with losing a cow or two every year from lymphosarcoma. So compared to other diseases like mastitis and metritis and lameness and Johne's disease, the economic impact in your average commercial herd is probably not nearly as high. If you have take for example, a herd with 200 milking head and half of them are infected, with this kind of a rate, you're only going to be seeing maybe 1 cow a year, 2 that have developed cancer that have to be culled. And so there's an impact, but it's not nearly as much as some of those other diseases. What are some of the signs that we see associated with those 2 or 3% of the unfortunate cows that do go on to develop cancer? Well, the signs that we see depend on where the tumors develop, and they can develop in a number of organs. The most common ones are the abomasum, which is the fourth stomach, and when they get tumors in the wall of the abomasum, what happens is that tends to erode through a blood vessel, and they will get abomasal bleeding or abomasal ulcers with bleeding, and when they have blood, digested blood in their manure, it looks like this black tar-like color. So we'll see the cows will be off feed, they'll get pale and anemic from the blood loss, and their feces will have this black tar-like consistency. Another common site is the heart. So we get these tumor masses in the wall of the heart, and that causes congestive heart failure. And what we see in the cow is brisket edema, bottle jaw, or submandibular edema. They develop fluid around the heart, which we have in some valuable cows we've tried to tap. But this, again, is usually a fatal infection, or a fatal disease, rather, infiltration of the heart with tumor masses. A third site that we commonly see tumors is in the spinal cord. And when the tumor puts pressure on the spinal cord, it causes paralysis, usually of the hind legs. And so you'll see the cow will get progressively weaker and ultimately fully paralyzed in the hind legs and unable to stand. And this is a specimen from an autopsy on this cow that shows this tumor mass that was in the spinal canal putting pressure here on the spinal cord. We can see tumors that are in the eye socket behind the eye, and they push the eye out, so the eyes will bulge. And we can see tumors in the uterus, which will result in infertility and can be detected on a rectal examination. So these are some of the common sites that we'll see tumors in cows that have developed cancer. Again, it's just the 2 or 3% of all infected cows. And it's usually a progression over several weeks. They may initially just be off feed with nonspecific signs, and then these more specific signs will develop. At that point, they're often culled, and they are not fit for human consumption if they have cancer. So there's, again, some of the loss has to do with condemnations at slaughter and culling losses. So what about all those other cows that were in that picture that I showed that are outwardly healthy but have the infection? So this would be, again, maybe half the cows in your herd, or it could even be higher depending on the prevalence in your particular herd. There's been a lot of controversy about this subject. And the question is, are cows that are outwardly healthy, is the virus having an effect on their milk production even though they don't show other signs of illness? There have been multiple studies. Many studies have shown that there's no difference in milk production between healthy but BLV positive cows versus their uninfected herd mates. Many studies have showed this. There have been a couple of other studies that have showed a minor reduction, about 2 to 3% reduction in milk production in herds that have cows with BLV. And there's a couple of studies here that have showed that the more BLV in a herd, the more percentage of cows within the herd that have BLV, there has been a very slight reduction in milk production. And for instance, in one study, it amounted to about $59 per cow in those herds that had BLV. So the bottom line is it may have a very mild effect on milk production. A lot of that may be some of those cows that are getting cancer and they're getting off feed and not eating as well and not producing as well before they're diagnosed. But again, the impact compared with other things like Johne's disease and lameness and mastitis is not significant and not as significant. What about some other things? So there's been some speculation that, well, if this is affecting their white blood cells, maybe it's going to affect their immune function. And will it reduce their response to vaccines? Will it make them susceptible to other infections like mastitis? And I just have to say that research is continuing on this subject, and I can say that BLV might affect cow health in cows, even if they don't develop cancer, but the jury is still out. And again, the impact economically is probably not nearly the level of things like Johne's, mastitis, or lameness. Now, if you happen to be somebody who's trying to export cattle, this does have a significant impact on your business because European countries and other countries will not accept animals unless they are BLV negative. And we're finding in people that are assembling heifers for export, as many as 10 to 20% of those heifers are testing positive for BLV. So that's a lot of animals that have to be removed, and it's a big hassle. So that is a major problem for people that are trying to export animals. So finally, we're going to turn here in the last couple of minutes to what can I do to control BLV? And let's start maybe first with the question, because everything that you do, a lot of times control costs money. Why should I even consider controlling BLV? Well, one obvious reason would be if you were trying to raise animals for export, for foreign markets, or if you're trying to raise bulls to sell to a bull stud, then obviously you have to have animals that are BLV negative. So that would be obviously a strong incentive. If you have a commercial dairy and you're not worried about selling genetic stock or exporting animals, but you might be experiencing losses from cows because of lymphosarcoma, and you may be experiencing some reduced milk production because of that and carcass condemnation. So if you happen to be a very high prevalence herd and you're losing animals from cancer, then you might want to consider control as well. And then finally, for what if you aren't perceiving an economic impact in your herd? If the human link is verified, which that article I showed you comes pretty close to verifying it, but if that becomes general public knowledge or if public fears are stoked, then clearly the consumer confidence in milk and other products of bovine food products, meat, is going to be, consumer confidence is going to be eroded. You could even end up in a situation where you have mandatory control, but even if control isn't mandatory, the public perception and the effect on consumption of dairy products, just think about what happened in England with the mad cow scare. This could be a strong incentive to begin now thinking about reducing the prevalence of infection on your farm, just so that if this does break, you'll be in a better position to eradicate. So in all these situations, the first step is to discuss with your veterinarian a testing strategy to determine whether your farm actually has BLV, cows with BLV. Again, chances are, if you're one of the 90%, that you do. But how widespread is it? So this can be done with either individual cow milk or serum samples, testing for BLV with the ELISA to see how widespread is the infection on my farm. If you happen to be one of those 10% or less that has a BLV-free herd, and then you just really need to work to maintain that status, and that would require maintaining a closed herd so you don't purchase additions. Remember, additions, if you purchase them, 50% likelihood that they're going to be infected. So if you are going to try to purchase additions, though, then they need to be tested before they are admitted to the premises and confirmed that they're negative for BLV. But let's talk about what if you're one of the 90% that does have BLV in your herd. So what would be your strategy? One, and your strategy will depend on your goals. Is your goal to eradicate the infection? If you have a low prevalence, then you might be interested in employing a test, segregate, cull strategy to try to develop a BLV-free herd. But if you have half your animals, which is like most herds that are infected, this is not going to be reasonable. You're not going to be able to get rid of half your animals. So this is probably realistic goal only for a very few herds that have a very limited prevalence. On the other hand, you might just decide to live with it and do nothing. You may not be losing many animals to cancer. It's not having really a big effect on production. You've got other fish to fry with mastitis or Ionis, so you might choose to do nothing, which in reality would be fine if you're not experiencing a big financial impact now. But again, what if that human link is confirmed or becomes publicized? You're probably better off beginning to address the problem now and being proactive. And so I would recommend that all farms should at least consider taking some steps to reduce infection. And this strategy is primarily aimed at delaying or preventing infection in the young stock so that they will gradually replace the infected older stock, as those are called, and replace BLV positive animals with BLV negative animals, thus reducing the prevalence and reducing the cancer losses. If you are trying to raise BLV negative heifers for sale, obviously that's what you need to do. And you can reduce the prevalence from, there's been shown herds that have taken some simple steps, reduce the prevalence even from 50% down to 10%. And then if you do get in a situation where we need to eradicate it in the future, you'll be poised to do so. So what are some of these steps? Well, we think about how animals are infected and we try to prevent the transmission. One has to do with colostrum management. Colostrum is a double-edged sword. We know that the antibodies in colostrum, if the cow is infected, she'll have antibodies in her colostrum, and that may actually help protect the calf. But the colostrum might also have virus, which could infect the calf. So the idea is to treat the colostrum to kill the virus, but preserve the protective antibodies, and this can be done in two ways: freezing, and it has to be frozen solid and then thawed, and that will destroy the white blood cells that have the virus. Or it can be heat treated. This would be like a low temperature pasteurization scheme, 145 for 30 minutes, and that will also preserve the antibodies and reduce the virus load. We can take steps to prevent transmission again, so we're going to keep calves separated from adults so that they aren't exposed to secretions that have white blood cells. We'll use individual hypodermic needles rather than sharing needles. We'll disinfect all of our surgical instruments between procedures and tattooing instruments. And we can use an individual rectal sleeve for each rectal examination, or at least if we know which cows are positive, we can change sleeves after examining a positive cow. So just some concluding remarks here. As we're running out of time, we know that BLV is widespread in U.S. dairies. As I mentioned, 90% of all U.S. dairies infected and at least half of the cows, dairy cows in the U.S. However, only 2 to 3% of infected cows will ever develop the cancerous disease caused by the virus, and that is what sort of limits the economic impact of the disease on commercial dairies right now. There are some fairly simple and cost-effective management steps that can be taken to reduce the rate of infection, which involves reducing exposure of young calves to older infected cows and preventing blood exchange between animals. And right now, the economic effect of BLV is probably less than the other major diseases we deal with, such as BVD, Ionis, mastitis, and lameness. However, if the link to human disease is confirmed, we really should be taking steps now to reduce the prevalence on our farms so that we're really poised to totally eradicate it if need be when that becomes necessary. I think that concludes my remarks, and we'll turn it back over to our moderator, and I think to see if we have any questions from the audience.
Well, thank you, Dr. Sweeney. That was very informative and a bit challenging for what the prospects may be for the milk producing industry. I just wanted to I'll look at some of the questions here. If you do have a question, feel free to go ahead and type that into the chat box, and I'll convey that to Dr. Sweeney, get a response. In the meantime, just want to reiterate I thought, an important point. As farms start to consider some kind of program to reduce the prevalence of BLV in their herd, you talked about targeting the young calf to basically start to generate a new generation of BLV-free calves, and you brought up the process of pasteurization. Now, is that a high temperature, short time type pasteurization, and would that necessarily need to be both for colostrum and if you feed waste milk, or is waste milk feeding not an appropriate practice for a herd that's looking at this given the higher prevalence of BLV in most dairies?
So that's a two-part question, and it is true that colostrum and milk probably do potentially need to be handled differently. And I think the problem with the high-temperature, short-term pasteurization methods with colostrum is that you can, I believe, have more damage to the antibodies that are in the colostrum, so you may inactivate some of the good properties. So for colostrum, and it's also, the proteins become more denatured, and I think it's more of a stickier mess. So for colostrum, we really recommend the lower temperature, longer term, the 30-minute pasteurization. With regards to the waste milk, I would agree that if in a herd that has BLV, waste milk that's not treated will have virus in it and is a potential way that it could infect calves. So I believe that for purposes of BLV as well as other diseases, pasteurization of bulk waste milk should be employed. And for that, either method is appropriate. The high temperature is fine there because you're not worried about the antibodies. You're just trying to kill any pathogens.
So pasteurization is fairly 100% complete in terms of eradicating or denaturing the BLV virus. I know we talk about pasteurization relative to Johne's disease, and there's some question as to whether pasteurization truly gets all of it.
Exactly. We're fortunate that for BLV, it is totally susceptible to the heat treatment. So it does not have the heat resistance that we see with the Johne's organisms. So with pasteurization with Johne's, you'll see a reduction in the number, but maybe not complete wiping out. Whereas with the BLV, you will wipe out the virus with pasteurization.
Well, that's encouraging to hear.
Yeah.
Again, we would encourage any of the participants, if you would click on the survey and give us some feedback on the information presented and ideas for future webinars, that would be greatly appreciated. We have another question here, Dr. Sweeney. Mm-hmm. One of our participants asks, other species-to-species concerns for this virus, for example, barn cats to cows. I think you addressed this a little bit earlier.
Right. So the feline leukemia virus, the only leukemia virus that cows get that we know of is the bovine leukemia virus. So the feline leukemia virus that cats get does not infect or affect cows. Now, interestingly, I mentioned cows to people as one potential zoonosis or cross-species infection. We do also know that sheep can be infected with the bovine leukosis virus. It's usually been by experimental exposure, but the BLV virus will infect sheep and can cause cancer in sheep as well. That's the only other species that I'm totally aware of as far as the bovine virus causing infections in other animals. But in cattle getting it from other animals, there's been no report of that.
And if we go back to that study that you've cited, the PLOS article that's implicated this, essentially in that study, if I understand what I read there, they've identified the RNA strands of this virus, but as to a cause and effect, that's not necessarily been established. It's the presence of this viral genome is there, and we need to further substantiate any direct relationship.
Right. You always have to be careful about association and causation. So, for instance, and I don't have the exact percentages at my fingertips, but some of the control subjects also had virus. So it was something like 20% of the control subjects had virus and 60% of the cancer patients had virus. So, the finding that there's more in the control patient in the cancer patient than the controls is certainly suggestive that there's an association, but you're absolutely right. It doesn't prove that it's the cause. I think in addition to finding the RNA, they also found a protein of the virus in some of these in those tissues as well. So, I don't think there's any question that the virus was there. What is difficult to prove is whether the virus was the cause of the cancer or a factor in the cancer, or just happened to be there because the tissue was already abnormal, so the virus localized there. That's the difficult thing to know, but it's pretty scary.
Certainly important area that needs further research.
Yeah, and I think I'm going to guess that it will probably continue to get more and more attention in the near future.
Okay, I don't see any other questions coming from the audience. We're getting towards the end of our time here, so again, I want to appreciate everybody participating and thank Dr. Sweeney for his excellent presentation this afternoon. Remind the participants that this has been recorded and will be archived within the next 24 to 48 hours at the DairyXNet site. And thank everybody for their participation. Thank you again, Dr. Sweeney, and have a good afternoon. Thank you.